Hello and welcome to our Friday webinar. Let's see, we're a little bit, we're like a couple of minutes into it already. So just want to welcome Dr. Tully. Thank you for coming back and doing another excellent episode of Ask the Vet. Very excited.
Well, welcome. I'm happy to be here and good to see you, Laura. Hope everything's going well in California, and also want to welcome everybody for the to the webinar, all of our attendees, and looking forward to having another interesting day and
Yeah.
Ask the Vet, and to see what we will all be able to learn and find out about these wonderful, wonderful animals that we interact with and have. I treat and try to keep healthy, happy, and live long lives, but also have my little ones at the house that remind me that they need a treat or two every once in a while. My
That's
wife
right.
thought the Senegal's head was stuck in the bell the other day, yesterday, and I'm going like, that happened, and
Oh, wow.
undoubtedly it was just enjoying having the clapper hit its head, and But anyway,
The clapper.
it was fine and doing well, and
So you're
but
saying the toy won.
yeah,
Won that
he like
battle.
in the morning he hits it like, "Hey, get out of bed and come give me something,"
Oh
some
my,
love. Yeah.
that's
But
awesome.
anyway,
Yeah. And just real quick, I heard, I mean, sorry. It's like I have this some noise going on. You're going off to China soon, right?
yes, actually, yeah, tomorrow. Yes,
Oh, really soon. Okay. So
yeah, tomorrow morning. But getting a chance to go there, and I'm will be speaking to my colleagues in China, in Beijing, and then there's a World Small Animal Veterinary Association meeting, and we'll be speaking at that meeting outside of Shanghai. And so
wow.
it's a great opportunity to see. I've had the been able to give CE before over there before COVID. This is the first time since then, but there's a lot of interest in avian medicine in China, and it's something that if I can go there and help promote and provide support for that growth, then I'm happy to do so.
Nice. And I mean, we kind of take for granted how many wonderful vets we have here in the US. And I'm not sure if it's is it harder to find avian veterinarians in other like countries that you
Yeah, I mean it's one of those as far as veterinary medicine goes, it's different in other other parts of the world and in other countries, as far as the needs and also the demand. But AAV, the Association of Avian Veterinarians, has always been an international organization. It isn't the American Association of Avian Veterinarians. It's always been international. It's the Association of Avian Veterinarians. And through this collaboration, we learn together. And that's one thing that has helped advance avian medicine over the years is the international collaboration, where you have everybody working together for the betterment of avian healthcare. And so it is in certain places it's a little bit more underdeveloped, but the support is out there to help continue to help it grow. And I can tell you worldwide, the expertise and the ability of veterinarians to treat birds has only increased significantly over the last 20 to 30 years. And we want to do everything we can to help promote that. Yeah.
nice. Okay, so wow, you better get some rest today after this.
it's it's just typical, we're always going, teaching, doing everything we can and research, and so but Also, I like to have, I say work hard, play hard, but yeah, we'll
Okay.
it's a long flight, so there'll be a lot of rest on that.
Oh man. Okay. So hey, I had a couple questions, or I want to maybe consolidate some of the questions. We ran an article, a blog on if you, I think it started off of as a TikTok video from a rescuer who said people often when they find a like a wild bird in distress and they think it's needs water, that they try to syringe or drip water down its throat, how that could aspirate the bird.
Mm-hmm.
And so just a question we had, a couple of questions we had kind of related to that is, if you're like one of them was saying, if your vet gives you your meds that you use a dropper to use, is that like, is there, you have to be really careful when you're doing that at home, when you're sent home with meds with the dropper?
Yeah, you can definitely, there's, as always with a question, it kind of mushrooms, right? It just gets, like a baking bread, right? And so in and of itself, you have to look at as far as a bird is concerned, the trachea, for most birds, I did find out that in some chickens breeds, the tracheal openings like way down here. I mean, that's like, I had to see it to believe it, but to try to intubate that bird was because quite interesting and difficult. But I for the most part, the in many species, the trachea is at the base of the tongue. So if you think about a parrot, it has a short little fleshy tongue, and it goes out and it touches you and it feels, and at the base of that is right where the windpipe or tracheal opening is.
Mhm.
Now, for humans, there's a flap of in mammals and in other species, there's a flap of tissue called the epiglottis, and it kind of covers it. It kind of closes it when you swallow, and it helps protect having food or anything go into the fluid or whatever go in. But sometimes it doesn't, and then of course something gets caught. It's something between the epiglottis and the opening trachea. Birds don't have that. They have laryngeal folds, and so they kind of fold together, but they don't have a flap of like a trap door to try to
Okay.
prevent things from going down there. It's just kind of like two little sliding doors going back and forth. And so it's much easier for that to kind of open if the bird is like, and it's at the base of the tongue. So if a bird like is trying to get air, well, it's going to be like you're just pouring it right down into the trachea. So that's what happens. Birds, if they are not being held and they're not being stressed as far as trying to breathe or try to get away or something, they can control that. But
Mhm.
if not, then so if you set a bird down and it can close that as opposed to struggling in your hands. And so I think that's possibly where it is. And we teach, if you're giving anything oral to a bird like a medication, you're giving or nutritional supplementation, that even if it's a gavage, going through with you're putting a tube feeding a
Mhm.
bird. You do all of your treatments, and that's the last thing you do, and then you set the bird down. So if it does regurgitate, that it can close it, and it's not in your hands struggling and trying to get air, and then aspirating all of that in there. So, if you have a baby bird that's struggling and you're trying to put water down its, in a syringe down its beak, it's it's basically, as you're looking at it, it's gasping, right? It's And so every time it gasps, that door opens and you're putting water. So that's what happens on something like that. If the bird isn't struggling, and so it opens its beak and you put it at the bottom of the beak, under the tongue, or on the side, it's unlikely to happen. We do that all the time, and I'm sure that many of the attendees have done that before very successfully. But you don't want the bird struggling. You don't want to do it first, or you don't want to feed the bird and then hold it and do all of these things. Anytime you give something in the oral, in the beak, you want to do that at the very end and set the bird down. And if you are giving something in the beak, you don't want the bird like struggling and gasping, because then that's going to increase the chance of the bird actually aspirating, having something go down. So hopefully that helps a little bit.
Yeah. Yeah. No, it's fascinating. Yeah. Okay. Yeah. Thank you for answering this. Okay, let's see what our first question is.
First question. So
yeah. Okay, so Laura wants to know what fresh herbs are safe to feed your bird. And number two, if your bird has dry feet and flaky beak, is coconut oil safe to rub on the feet and the beak? So safe herbs and can use coconut oil.
Yeah. Safe herb. And this is a great question. So what is safe, and what, as far as an herb goes that you can treat a bird, and rubbing coconut oil on the bird is was that the beak? Did that say?
They want to know if coconut oil, if it's safe to rub on the bird's feet and beak, because they're
feet and beak. As far as that's a good question, because what do we feed it? And I've mentioned before about, I had some canary people look at comfrey, and comfrey is a kind of an herbal, and you have comfrey tea, and you can look that up, and they said the birds love it, and said, well, is it okay? And so I said, well, I just don't know much about comfrey. I'll look at it. The next thing I know, and as some of the attendees who may have been earlier webinars found out, comfrey is hepatotoxic. And so in who knows what amounts, but what that means is that it's liver toxic. It's toxic to the liver. Obviously, people have drank comfrey tea, and it's not haven't died from it or whatever. But the amount of comfrey or what have you, how much do you feed? How much is good? How much is detrimental to the patient, or they've had hepatotoxic incidences in humans with that. And with that, I told the canary, the owners of the canary, I said, I wouldn't feed comfrey to my canaries. There's too many other things to feed. And so when you're looking at herbs, there's no, whether the bird eats them or not, there's no studies that have been shown, well, how much do you feed? How much is safe? Is there any adverse side effects too if you have too much of this this herb is ingested? And so the one thing that I would say is, if you are looking to feed something like that, feed a herb, is it safe or not? To look up and see if there's anything with that particular herb that would be, say, in humans. If it's been done, given in humans, or taken in humans, or there's products that are manufactured, to see if there's been any adverse, like I did with comfrey. I mean, it popped right up on the search for that. So that would be somewhat what I would look at, and if anything, you say, well, I haven't found anything, I would just do it in moderation, you know, as part of a kind of the part of a kind of a treat like thing, you know, not part of a major um, uh, part of the diet for sure.
Mhm.
But and then any benefits, if you're looking for any herbal benefits from it, then that is totally unknown on that. And so maybe if you know, positive things, you know, think, well, I think it's going to you know, work, then possibly that would be as much of a way to try to get it to have a positive effect. But no, I would be careful with any herb. Look and check and see if there's been any in humans or any animal where there's been any problem. And if it's a popular herb, that I'm sure, and it's in many products and teas or what have you, then I'm sure that if it's out there, you know, you'll find where there is some problems with it. And then as far as the coconut oil goes, I would say that possibly on the beak, that wouldn't every once in a while wouldn't be problematic. And on the feet, I'm not sure that I would do that that often on the feet. I don't. I can't think of, if you do it every once in a while, that it would be an issue. Laura, I don't think it would be an issue if you do it every once in a while, but I have a tendency to you know, not to put things on the skin
Mhm.
of birds, because it kind of quickly um, uh, it quickly deteriorates, as far as it gets more complicated on that. And so I don't think that every once in a while will make any difference one way or the other. I may be wrong, but on the beak, I would say that you could probably do it more on the beak than I would on the feet.
Okay,
You know,
okay.
but
And
I
I'm,
just, you know, like good nutrition, keep them water, baths, showers, things like that, on that.
but I mean, like beak in general, beak flakiness is normal, correct? Like some
Yeah, yeah,
flakiness.
you know, the beak flakiness. I mean, you bring up a point as far as like you know, we have people, well, I need a beak trim. Well, the one thing that anybody who has a parrot, if they um are saying, I don't think this bird needs a beak trim. Well, what do they do? You know, well, the first thing you do is just go online and look what a normal beak, you know, a normal picture of that species, and say, well, how does that compare a picture with my bird? 9 times out of 10, that beak length is going to be the same. Okay. Now, of course, I've had the beaks that have gone all the way over, beaks that have, you know, upper beaks that have been poking in the pectoral or chest of the birds. I mean, really long beaks. Um, but as far as the beak of a bird is concerned, and may have mentioned this before, but it grows from a bone. There's a bone that's attached, and they have a joint at the frontals, and so it's a bone. And so the beak grows out from the bone. The beak doesn't grow like a, you know, it's like a
Oh,
fingernail or something like that. It's not going to grow here. It grows out. And then it also grows long, because that's part of the out. If you look at it three-dimensional, it just grows long and on the sides, but it's growing out, and it's and the majority of the beak's a bone. That's why if a bird goes to another bird in the room and says, "Hey, how are you doing?" and that bird says, "Not really well," and just takes off the beak, it's not going to grow back. It's just going to be a flat space on the and heal. Okay. So
Yeah.
it's not going to grow back. So it took off the entire bone. Now, the irregularities that you mentioned that are normal that you see, yes, that's because it grows out inconsistently, and you have it, it kind of grows out, but you have abnormal, variation in the shedding and the sloughing of that those cells on that beak. So it's irregular, and then you can get some with little steps in the beak. You can see where they get a little step in the beak. And so normally when people come in for their beak trim, it's not a trim per se, but a smoothing of the beak out. And so they were mentioning coconut oil on the beak. We'll, after we trim the beak, other than cockatoos, we'll put a little mineral oil on the beak. And so after the groom, but it will just smooth that out. So it is the irregularity of the beak on the outside. The reason is because it's growing from that bone. So that's why that occurs, and that's why if the beak is bit off halfway, it's going to be a half beak. It's like only at the very tip, if it is knocked off, will it grow to look normal. But if any of that bone is compromised, well, that's where the beak's going to end. Yeah.
Okay, a little stubby beak. Okay, all right, there you go. Frank wants to know if it's safe to use very small pieces of raw English walnuts for training. They have a 15-month-old double yellowhead Amazon, and so he points out that they're high in fat. Is it okay to use it for training, the English walnuts?
Yeah. Oh, yeah. I have a training, and if the bird really likes them, small, see, that's one of the things for me. Okay. This is Ask This Vet.
Yes,
Right?
asking you.
So, that's, I'm going to put that caveat in here. So all of these questions are from this vet. The answers are. So, my thoughts are, if you have a treat like that and make it, and not to give it a whole half of an English walnut, but you cut it up into some manageable pieces, that if that's what you use as a treat in training, that's fantastic. That means the bird doesn't get it any other time. And therefore, if you use it in operant behavior training, then that would be what the bird is looking for in return to doing what it is, you want it to do. And so you have more influence on that bird by having that as a treat than if I give them some, but I also use it as a treat. So there's nothing special about it, really. It knows that it can get it from you at any time if it does something, to get it, if it pitches a fit, whatever pitching a fit is. I just like the terms, pitching a fit.
Well, with an Amazon, it could be loud, maybe.
Yeah. So anyway, but if you have anything like that, and I was at the Houston parrot little conference and in January, and they had little like slivered almonds that somebody was selling there at their for training, okay, to use for training, and it was little pieces of almond or what have you. But I think that is perfect for for training, because you don't give it other than the times that you are training the bird, and that makes it, it provides more influence of those treats to enhance the bird to do what you want it to do.
There you go. Okay. Okay. Maribel has a question about chickens. I'm sorry. They have chickens. They have chickens, parrots, and dogs. The chickens suddenly had started suddenly having difficulty walking. They tried to give her various vitamins and isolated her. She got worse by the day, and we decided to euthanize her with the local vet. So they're concerned that the others might get it, as it appears she had Merrick's disease. So although the vet said they're unable to verify it, what's the likelihood that the other girls can get it, the other birds, and how to prevent to help the others before it's too late? So do you want to Merrick's disease? Does that?
Merrick's disease, chickens is it's a common disease condition, so common that it's one of it's one disease that the chickens are vaccinated for. Okay, all chickens for the most part are vaccinated for Merrick's disease. In kind of a commercial setting, they can vaccinate in the shell. They can vaccinate when they're 1 day old. So there's various ways to do that. But of course, if you're getting birds for for a backyard situation, that you could get them just about anywhere. But most reputable, well, I wouldn't say reputable, but most people that are knowledgeable, I'll go with that, and sell birds, sell chickens on a large scale, as opposed to, oh, I have some birds in my backyard, I'm gonna, they're gonna vaccinate those birds. And so if you get them in that manner and you ask, then they'll be vaccinated for Merrick's disease, because it's that common, and the exposure is that high for Merrick's disease. Now, you had this Merrick's disease. It affects the nerves, and as it affects the nerves on the bird, what you usually see when you mention that, one of the first things, it sounds like maybe it's Merrick's disease. You can have this in birds over 6 months of age. The first thing that you notice is that they start limping, and then the next thing you know, they can't even use that one leg. And and so one thing that you could look at is, if you do an autopsy, a necropsy, animal autopsy, you could look at the one of the nerves, the sciatic nerve, and as it's going to the leg, and one side will be normal and the other side will be greatly enlarged. And that's one thing that you can look for to try to confirm that's in fact what it was. And of course, there are other tests that can be actually used to definitively diagnose if you get a necropsy. But that's how, and it affects the birds quickly, and they really don't recover. And so because, like I said, these birds are extremely susceptible to actually exposure. I didn't say they were, and that they would become, as far as show clinical signs of the disease, or even become like what you would say infected. They can become infected and just be subclinical carriers of the bird of the disease, meaning they don't show any signs of disease and they just live a normal life, but they're carriers, a typhoid Mary, so to speak. So if you had birds that weren't vaccinated and this bird did in fact have Merrick's disease, and it was walking around with all of your little other birds, and they were saying hi in the morning and good night and all of this, had little bunks next to each other, then you have to consider, in my thought, that those birds were exposed. And then you say, well, let me go out and run out and get a vaccine. Well, you can vaccinate the birds, and from what we know today, it may change. That if they're not showing signs, you vaccinate the birds, it may boost the immune system and they have less chance of getting it. But in most cases, if you don't vaccinate the birds in the shell or on day one, and they are exposed to the virus, that it's not going to be the vaccine won't be effective. Okay. Now, you have nothing to lose to vaccinate the birds at an older. It may help. Who knows? I think that, there's people that will say, we know all about vaccinology. We know the vaccine's not going to be effective, that they'll get it. Well, I'm afraid that's a little hubristic in the fact that we know everything about vaccinology. It does, people will say it's not going to be effective. That's the word on the street. That's what would, as far as the poultry community. Okay. But I'm saying you don't have anything to lose if you want to do it, if the birds aren't showing any signs. But in all likelihood, based on what we know now, it's not going to be effective once the birds have been exposed. And you have to consider all the birds that were with this bird exposed.
Okay.
Yeah.
All right. So Sandy wants to know, what do you recommend for helping a 30-plus-year-old Amazon's macaws with sores on the bottom of the feet and/or arthritis? You perches, vitamin E, aloe, other. So we've got some.
Okay, so are we talking about a macaw or an Amazon? And in the end,
Both.
does it make a difference?
Both, yeah. But they're all, well in their 30s. So
on the bottom of the feet. And great question. And because I saw a 1986 model yellow-naped Amazon.
19 model.
Huh? 86 model. Yeah, so that was just a few years ago. And it was great to see a yellow-naped Amazon. I don't just see them every day like in the past, but of course it was an older bird, had cataracts and but still hanging in there and doing well. Body condition, it's Amazon body condition, a little bit well conditioned, let's say. And on the feet, had smooth areas on the feet. And so this is what we would consider, as far as we call it foot irritation, pododermatitis, or foot skin irritation. Okay. Podo, foot, dermatitis, skin inflammation. So really, as far as the, how inflamed, it's smooth. Okay. So you should have the kind of knobbly appearance of a typical parrot skin on the bottom of the feet. If it gets smooth, of course, we've talked about pododermatitis and bumblefoot before. But of course the weight, and if the bird is on a perch that is does not have variations in the diameter, say like a natural branch, then it's always sitting at the same area on the bottom of the feet. And then that is, of course, there's not much cushion. They don't have nice cushiony shoes on their feet. They just have little fat pads and skin and bone. And so if they're heavy and they're sitting in the same place, it's just like, your booty falls asleep if you're sitting in the same place all the time. Okay. And so that's what happens to their feet. Their feet go to sleep. And so that it causes after a while, the vessels to, it gets smooth, and then you have lack of vascularity to that area. And then it gets to where you have sores. And this may be the case with the owner of the macaw and the Amazon. Now, if it's just smooth, you can work with it. You can make sure you have vitamin supplementation, and then particularly vitamin A helps in that. Multivitamins that we mentioned, the products, the Necton products, the Lafeber vitamins, use as directed. But also what you're looking at is, you're correct, the perches. You want to make sure, to me, okay, what is the best perch for the birds are natural wood perches that have variations and undulations in the wood that actually provide, no matter where the bird is perching on that is going to provide a different surface area on the foot that's going to take the pressure, as opposed to a dowel uniform perch or any type of uniformity in a perch where the same place is getting all the pressure all the time. So, Manzanita perches, different, but even just going out and making your own perches from a hardwood tree, maple tree, oak tree, what have you, and Lord knows, oak's toxic. I don't think that we're going to have termite, the birds in there, that's going to be eating the wood, to where it's going to be toxic for them. And oak's a hard wood. And so if they want to, actually try to pick at it and tear it apart, that's going to last a little bit longer on there. And wash it if you do that, but it's a cheap way to get good perches. And if they tear them up, then of course you're going to get a different perch that's going to have a different structure to it, and that's going to even make it better. So I think that's what you're looking to do to try to help prevent and reduce the complications that may be associated with it, or the increasing severity of that type of a process, that problem. Now, if it gets to the point where you have an open ulcerated area on the bottom of the foot, sometimes that they can have granulation tissue, and we see that in chickens and ducks and of course in raptors, and we're talking about falconry birds and hawks that are maintained in captivity for hunting purposes. But we'll see that, and then we'll have to look at reducing the possibility. If it's ulcerated and open, then you have the chance for infection. And then we want to make sure we clear up any infection that may be in there. If it is, we clean the wound and then we close it, because just bandaging an open area under the foot, when will it heal? Well, how much time do you have? we'll be here like in 3 years. So what's it look like? Well, it still looks the same. That's a long way down from where the blood flow and, getting all the treatment and that tissue. Not saying you can't have healing, but it has to be, it's a lot quicker if you don't have infection to close that up. And that in 14 to 16 days that'll be healed. That's if it's open. So great question. Thank you. Excellent.
So much on the feet. Okay, so we have
Yeah.
a question from Krishia about, is vomiting a symptom of being overheated? So their blue and gold threw up for 24 hours. They think it was possibly a bad Brazil nut or the heat. The vet said she didn't think anything was concern after they, was brought in for after a physical exam. So
Okay. Great question. I tell you, do you plant these questions, Laura? I mean,
I don't know what's coming through the pipeline.
they're just
they
great
appear.
questions.
Yeah.
Yes, vomiting. And so therein lies a question. What's the difference between vomiting and regurgitation?
Yes. Remind us again, because this is like, yeah, I too get confused between the two.
Well, I think that I'm just going to tell you what my thoughts are, and I had to write something in a book one time, a short kind of a 5-minute veterinary consultant on this vomiting and regurgitation. And so my my definition is that regurgitation is from the crop. Okay, anything that the bird has, and it's just in the crop. It does not go into the stomach. Okay, if it's in the crop, which is a dilatation of the esophagus, and it comes up, that's regurgitation. If it is in the stomach, then I classify it as vomission. Now, it's semantics, right? But that's health-wise, because they're going to say, well, does the penguin, if it eats it, is it regurgitating the food to the young, if it's catching all the fish in the sea and keeping them in its stomach until it gets all the way up to the iceberg and the little penguins are out there, and then is it regurgitating, or is it vomission? And so I'm saying that health-wise, in this way I'm looking at it, if it comes from the crop, regurgitation, and if it comes from the stomach, it is vomiting. Okay. So that's the way, I guess, for this webinar, we'll kind of classify it, and that's the way I teach it. Now, as far as this macaw, I'm thinking of Ebenezer Scrooge when he had a bad piece of meat when he first saw the ghost. So was it a bad Brazil nut that caused this? Well, it's kind of possible that there is something that could disagree with that. That happens where the bird eats something that it's like, no, and it does regurgitate. And it would be interesting to see if it or vomited. It would be interesting to see how after it ate, how soon after it ate that this occurred. Irregardless, it would be likely, okay, that it was a something that it ate, possibly a bad Brazil nut. That if it was a one-time thing, okay, well, it just happened, but we were concerned. We took it in. There was no, we looked at the CBC, see if it was an ingluvitis, if it was a crop infection that was causing inflammation. because that's what a CBC will tell you, inflammation, it will not say it's infection. But the inflammation could very well possibly be caused by that. The inflammation could be caused by something else. It could see if that's what it was. If everything's normal, there's no problem there. Then the bird responds, the kids just eat, and the stool's normal, no other issue, then very likely it was something that it ingested that just didn't agree with it. But if the bird continues to do that, then it can get a little bit more complicated. And then that's where you get into the situation where you can have a bacterial infection, and then it can all go into it could even end up being something along the line like we see in a lot of younger birds over the years called sauerkraut, where you have fermentation actually occur in the crop, and not only fermentation that occurs in the crop, but you know, that you have growth and of yeast that is occurring, candidiasis, candida on top of possible bacterial infections with that. So that's what you're looking at as kind of if the bird is continuing, you'll have to look at the possibility of a bacterial infection and treating that, where we do cytology of the crop if this reoccurs. I'm saying this because, Laura, this is something that we see. It's not an uncommon presentation with regurgitation in birds, in parrots, and we'll see it. And on top of that is where it's a chronic regurgitation, and you have birds that are, doing this, and we take cultures and we say it's an ingluvitis, which is crop inflammation, and we take cultures and we say, oh, look, we have the pathogenic, oh, look, the bacteria, we've identified it, we have the right antibiotic, we put the bird on the right antibiotic based on the sensitivity, and the bird gets better. Then in about 3 weeks, it's back. And so we go like, we're gonna have to take another culture, and it's a different bug. It's sensitive to something else. We treat that. Bird gets better. Not. One of the things that if you have this chronic regurgitation in birds, what happens is that it's not where you treat and you identify a bacteria. Say you think it's an infection, and the bird, you treat it, it's better. That it gets then it gets worse again, and then you find another bacteria. This is where treatment does not seem to be working for the regurgitation. What is out there, and that we have diagnosed, and it's difficult to diagnose, is stomach cancer. Birds, and that's what this chronic regurgitation will have, and it's very difficult to diagnose stomach cancer because the bird's regurgitating. And it's not the first thing that comes to mind. Oh, Lord, we've got stomach cancer here. It's not like the typical, but if it doesn't respond to the treatment, and you have these multiple organisms that are being identified, it means that the bird's susceptible to these pathogens, and that and why is it susceptible? Because it's not functioning properly down there due to cancer. So we go from a one-time or a two-time thing that it just didn't agree with the bird, to infection that could cause an inflammation that causes it more often, and it can develop, and it can go into like a sauerkraut even in older birds. And then you have stomach cancer that can also cause regurgitation. So that's kind of the variations. Of course, after you have the 1 or 2 times that it's something that it ate or ingested, but if it continues, then you have to try to identify what the problem is. Most of the time, it's an infection or something, and take care of it. Yeah.
Okay. All right. Someone asked, what's your opinion on DNA sexing kits that are mailed to a lab with a blood sample, like from a blood feather or the nails quick? They are now testing for psittacosis, PBFD, and many other diseases, but they're skeptical. So what's your thoughts on if you mail in, can they test for all that with a mailing kit in addition to DNA sexing?
Well, this is a very important question. I mean, it's a good question, but it's an important question. And I would say that with these type tests, it's the one thing that I would kind of thinking out loud here in my own mind here as far as the testing is concerned, is that I only would use a reputable lab that is been accredited and certified by a national diagnostic laboratory oversight. And so there are labs. I mean, ever since I graduated, there were a diagnostic lab in Seattle. They found out that send them a radiograph or something like that, and it was out of a garage, and doing it. I'm not saying any lab I don't even know what lab you're talking about, but I'm just saying diagnostic laboratories in general have always been trying to sell something that will tell you the answer for a disease or sexing or what have you. And so it a lot, and you want to do it through a reputable, like I said, a reputable lab. And a reputable lab to me is one that has been is part of the national accreditation of diagnostic labs, and that has been where they go in and they look it over, and they pass the inspection, they inspect it, and that it's all there, because these tests have to be run specifically because the contamination occurs so easily, and and also that the tests are validated. And so I can open a lab tomorrow in my garage. I can, and I can start advertising for it and have samples submitted and just send things out. And so this is something that I am always teaching and telling people about, as far as the students, to make sure that they do this, and not just because of cost. And the labs that are in question have low cost. They'll tell you everything. They'll give you answers on 1 drop of blood for 18 different diseases, and sell you vaccines that have no scientific validity, but they'll sell it. They'll run these tests on it, and so therefore that's why I only use those labs, like I said, that are accredited by the National Diagnostic Laboratory Association. And then because I know that they have passed some type of criteria. Also, you go into DNA sexing, and it's in you know as it is. I you only utilize the Zogen testing. That's the only one I'm going to recommend. And so with the Zogen testing, it's a blood sample, and you submit the blood sample. That's the only one I'm going to recommend. And even with that, we've had so how accurate is that? I don't think even they've proven even laparoscopic sexing, where you do take an endoscope and you go in and you see the gonad, is not 100%. You can have some anomalies. You can have young birds where the ovary is not as so easily identified. But I've had DNA sexing even with Zogen and Joy Halverson, who started the DNA sexing back in the early 90s, and so there's a long history of that and understanding. We've had birds that were DNA sexed a male, laid an egg, and it's not divine intervention. So we're looking at that it's not 100%. But it's probably in the 90s, I would say, maybe upper 90s, but it's not 100%. So, that's, but I don't know of any tests that are 100%, if they're not dimorphic, the eclectus, 100%, red female, green male. So anyway, so that's what that, but beware. Please, caveat emptor, buyer beware, right? With the diagnostic testing, just use a reputable lab on that, an Avian, diagnostic lab that has been accredited and approved, and I can tell you, if you ask them, they're going to probably, and they haven't been, they're going to give you every excuse in the world why that is just like, oh, we're not going to do that. Yeah. Well, yeah, I tell you, they'll give you excuses to rationalize why they don't, to convince you. But to me, that's the criteria right there.
That's the Tully criteria. There you go. You got it.
Yeah. That's because if I'm going to spend money and I want some results,
Yeah.
that, and again, with the lab results, I interpret them. What do I think? Does this make sense? I'm not going like, oh, well, look at here, I'm running these tests, I can run them to screen. Okay, well, it may not. Well, from the test, it says it doesn't have it, but in most cases, that doesn't guarantee it doesn't have it. When I run a test, when I, say, oh, these signs, let me just run all these tests to see what this bird has. No, I'm running the test specifically for what I believe the bird has based on the history and the clinical signs that are associated with that disease. So it's like, if it comes back positive, it's like, yep, that's what I thought. If it comes back negative, then it's like, well, why is that the case? And we have to regroup and try to find out why it looks like this, but it isn't this. So it's not just like when I get those tests back, it's like, oh yeah, I believe the lab. The lab is something that those tests are helpful. And that's just like if you have the DNA test, surgical sexing, unless you can see that ovary or, confirm that is testicle, well, that's what it says DNA wise. And there's a really good chance that that's what it is. But there's a, if it's not dimorphic, there's a chance that male macaw may lay an egg one day,
Right.
But anyway, There you go.
I'm reminded of
Great question. Great question. Ah, as always.
yes.
What
I'm
a
reminded of the stories of I've heard a couple of stories where people have submitted like their dog's DNA to like a 23andMe or an ancestry.com and it's come back with results as like as if they're human. Like I don't know. I'd be curious if someone submitted their birds, you know, they'd be like, they're from Australia, or they're from, you know, South America. If they
I love that, Laura. I mean, that is that. Oh,
yeah.
oh,
Don't do
gosh.
that though. You're gonna be doing that now with
I
your bird patients. You're gonna be submitting them to see if they come back from the right continent.
well, you just don't know about that dog, do you? You just don't know what he's, you know, don't know where he's been.
Yeah.
The family history. Wow.
Yes. But like
I
as a
love it.
human. Yeah. So there you go. All right. Oh, well, we were done with our questions for today. Gosh, if we didn't get to your question, we'll try to answer it for you, right? Right. Well, we'll definitely be seeing you in September after your trip to China. So you have to tell us a little bit about your trip from China when we see you next.
Yes, I will. I will. Won't take up too much time so we can get the questions because these were wonderful questions as usual. I mean, fantastic. And we hit on a lot of topics today that we normally don't. I'm trying to think what day. It's on the 27th. 27th of September.
That's right. Yep. Thanks for that. Now you just did my job for me. You just hit the date. I was going to say the date, but you did it. So yeah, we'll be back with you very shortly, like in a month. And then our next webinar. So we got the Labor Day holiday coming up. So we're not going to have a webinar then, but we'll be back. Well, we'll be back on September 13th. This is going to be interesting. Dr. Lamb, Stephanie Lamb is going to give us a bird's eye view of a vet visit. So I think she's going to try to give us like literally like what the bird would be feeling going to the vet. So this will be an interesting topic webinar. And just another reminder, I've been talking about it like for a couple weeks now, but I'll be seeing Dr. Lamb and hopefully anyone who's going to AFA on it's going to be September 4th through 7th in Costa Mesa, California. So be there. So if you can make it, that'd be great. If you guys, anyone can join us, we'd love to see you there. Yeah. And I got to announce today's winner. And this is going to be some strawberry nutriberries as well as a product of your choice from Lafeber. And that is going to Krisha Ungano. I hope I said the name right. Congratulations.
Right,
Yay.
Yay.
Yeah. So the strawberry nutriberries, they're seasonal. And so we're kind of coming up on the end of the season of the strawberry nutriberries. So get some if you can. They're really refreshingly, like I love opening the bag. It just strawberries. It's
kind of had a banana and strawberry mix, right?
oh my gosh, we could take the banana nutriberries with the strawberry.
And mix them with the strawberries, you know. I don't know.
Yes. Oh my gosh, that's a great idea. One of my favorite pies is this local Polly's Pies has a banana berry, and it's like bananas and strawberries. It's like my favorite pie.
Oh, there you go.
There you go. Wow. Okay, good idea. There we go. And that's from Dr. Tully. Okay, guys, I guess that's it for today. Yeah, I guess we'll have a wonderful trip to China.
Yes, and you have a great AFA conference, and please support AFA. A fantastic organization, does wonders for birds and parrots, and I mean, so Costa Mesa. I mean, hey, that's pretty nice.
You're like a stone throw from Disneyland. It's like right by Disneyland. You can come on.
There you go. There you go.
And there's so many other events going on. There's going to be like a zoo excursion. They're going to a parrot themed pub that has like the wild parrots that come and settle in the evening. And then they have Family Fun Day. Lafeber sponsoring that on the Friday. So that's free to kids and everything. So, all right. On that note.
Well, thank you so much, Laura. Thank you, Brenda, Lafeber, and all of the attendees who make this possible and such a wonderful event as we put it on. And yeah, go hug a parrot.
Nice. All right. Everyone say safe travels, and someone hopes you see flying squirrels in China. So yeah, let us know if you see flying squirrels in China. There we go.
Okay. I will. All
right. Safe travels.
Thank
you. All
the
best, everybody. Till next time, stay safe. All the best to you and your flock. Bye.
All right. Bye-bye.